addiction service providers across Ontario to recognize September as Recovery Month. It is so fitting that we are here today at Pine River Institute, a leader in treatment for youth with addictive behaviors and a place of hope and a place of development for many. Each and every day here, the students, their families, and the amazing staff, led by Vaughn Dowie, work so hard at recovery. I was here for the first time 5 years ago, and Vaughn was just pointing over there at an empty space in the field and talking about the dream he had for this building here. And I'm so happy the Ontario government is announcing these new beds today. And he said, you know, the kids deserve a better place to live while they're here. And I'm so happy that they're getting it because they deserve it. They work so hard to address the underlying mental health challenges and history of trauma that often contribute to addictive behaviors, to learn and develop new skills and resiliency, to build stronger and better relationships with their family, all in the goal of a possibility at a future, at a family, at happiness, at a career, at getting back to school and back home. Pine River is the perfect example of what's possible when we support those struggling with addiction or substance use. But the first step for many who live with addiction or who use substances is often the hardest step, and that is reaching out for help and support in the first place. That is why September is such an important month to Addictions and Mental Health Ontario and to the broader addiction and mental health sector in Canada. It's a month where we are focused on fighting the stigma that remains around substance use. While we have made a lot of progress in Canada, in Ontario, specifically when it comes to mental health, addiction and substance use remain highly stigmatized in our society, and that makes people get sicker, and sometimes it causes death. Many people fear reaching out for help because they remain concerned about the impacts of how they will be judged by their family, their friends, their peers, their employers, and even their healthcare team. We cannot continue to allow this to be the story for people who live with addiction in Ontario. And as citizens, we each have a role to play. We need to recognize that people living with substance use challenges need to be met with the services and supports that will treat their individualized needs, whether that be supervised consumption, clean supplies or other harm reduction services, peer support, withdrawal management, outpatient or live-in treatment, housing, income, and food security. People need the services and supports that will work for them, just like the youth who need the services here at Pine River, and now will receive them faster thanks to today's investment. I want to thank the Ontario government for being here today and for helping to mark the first official Recovery Month in Ontario, thanks to MPPK and his private member's bill. I also want to thank all of the mental health and addiction workers across the province, including here at Pine River, as well as the volunteer board members and all of those who have donated funds for this project. And I want to thank all of you who have shared your story this Recovery Month. It is you, above all, who continue to stand up and challenge stigma. Thank you.
Jamie? Aye.
A couple of weeks ago, nurses and doctors being harassed by anti-maskers as they went into work. This weekend we see anti-maskers assaulting police, wrestling with security guards to try and get into the Eaton Centre because they think it's their constitutional right that they go into the Eaton Centre. What does the government have to say to these people that are carrying out these protests?
Well, first of all, we recognize that people have the right to demonstrate peacefully. That is within their rights, but not to get into angry confrontations, not to fight with police, not to fight against the rules that we already have that are encouraging people to be vaccinated. If you choose not to, fine, but other people do choose to. The vast majority of people have chosen to be vaccinated. We now have over 85% of our adults, of people age 12 and over, who have received their first vaccination. We want to get it up to 90% because we know that is really important to protect everyone in Ontario. The health and well-being of the people of Ontario is our government's top priority. And so if you don't want to receive the vaccine, fine, but a peaceful protest is fine, but angry confrontations where people can be hurt is not all right. It's not okay.
There was a poll released that showed that people that are vaccinated are starting to build an intolerance or being angry at the people that aren't vaccinated. And this is causing a polarization, which resulted in what we saw yesterday. This separation, is this mendable? Is this, is the government can give words to advice to these people?
Well, we'll continue giving the advice to people that we always have, which is the best way to protect your own health and well-being, that of your family, your loved ones, your community, is to be vaccinated. We have safe and effective vaccines in Ontario that have been thousands, millions of people have already had them. We're going to continue to ask people to be vaccinated. We do have our vaccination certificate now that is required to go into many places, to restaurants, to fitness studios and other locations. So we're going to encourage people to please be vaccinated. That's the best way to protect yourself and the people that you care about. Hi.
Hi. The Toronto Medical Officer of Health is asking the Ontario government to add COVID-19 vaccines to the mandatory vaccines for students. Can we please find out if you are considering this?
Well, we're going to take a look at anything that is going to protect people, including young people. We know that the take-up of 12 to 17-year-olds has been very good with respect to receiving the vaccines. Now we're waiting for finalization on whether the Pfizer vaccine in particular can be used for children age 5 to 11. That is something that is important. We want to have as many people vaccinated as is safe and possible. So we are continuing to look at ways that we can continue with that, and that is one of the ways we're looking at.
Well, just this facility, there was always a deficit in facilities like this coming, and there still is. How much more are these facilities going to grow, and are they going to be able to keep up with the people that are in trauma or in crisis as a result of COVID?
Well, we're continuing. We knew that as a result of COVID, there was going to be an increase in the mental health and addiction needs of people across the province of Ontario. Youth are no different. There's been a lot of stresses and strains for everybody during the course of this pandemic, and so we know that the need is going to continue to grow. It's going to be with us for some years, and so we need to have more facilities. I think that Pine River was very forward-looking, I guess, in terms of having this beautiful facility already available, and so we will be able to open the beds here by March of 2022. But there will be other places. There are other facilities in other parts of Ontario that we are going to continue to encourage to expand as well, and that is something that has been a priority for our government, the mental health and wellness of all of our residents, no matter what age, and that mental health is health. It needs to be looked at in the same way that we look at physical health. So we're going to continue to expand to make sure that anybody who has a needs for their mental health or addictions challenges will be able to get those services in a timely manner. So thank you very much.